Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Safe Kids Upstate New York is a coalition committed to preventing unintentional injury and death in children. Today, I'll be talking with its coordinator, Liz Sapio, from the Upstate Golisano Children's Hospital. Welcome to the Informed Patient, Mrs. Sapio.
Hello, thanks for having me on.
Before we get into the details, can you tell us more about Safe Kids Upstate New York?
Sure, I'd love to. Safe Kids is a worldwide organization. There's over 400 coalitions across the country and a few in other countries as well. We are the Upstate New York region. There are 10 specifically in New York State covering different areas. We cover from up towards Jefferson down towards the Broome County line down to Pennsylvania, pretty much our upstate trauma footprint that we cover as well. Safe Kids Worldwide was started back in the early 80s in Baltimore, Maryland, by a group of pediatricians that had recognized that a lot of children were coming through their emergency department gravely injured from preventable injuries or unfortunately had passed prior to arriving to the hospital. And so they began looking at these injuries and the causes of these injuries and recognizing that we aren't doing a very good job letting the community know that these are preventable and what are the simple things that we can do. So it really came from an effort of understanding more children die from preventable injuries every year than all other children dying from diseases or other illnesses. So it is a very high risk for children. And since this started in the 80s, they have done a tremendous job of decreasing the death and major injuries to children over the past nearly 40 plus years. This coalition, specifically the Upstate New York Coalition, has lived in our community since 1995. It was started by a group at Onondaga County Health Department, including our Crouse partners next door, and then eventually moved to the county health department. And once our children's hospital was built nearly 17 years ago, if you can believe it, we turned 17 in September at Upstate Golisano Children's Hospital. The idea was, let's bring this position in this program here because we are going to be a level 1 pediatric trauma department. We are going to directly have the data and the wherewithal to understand what kind of injuries we're seeing in our region so that we can do a really great job at nailing down specific injuries and areas and how to prevent them and reach those communities in a more meaningful way. So at that point, the position came over, and I specifically have been working as the Safe Kids Upstate New York coordinator at Upstate Golisano Children's Hospital since 2013. But prior to that, I had sat on as a community member for about 7 years.
So Safe Kids being part of a worldwide network, how different are the coalitions? And do you communicate with coalitions in other countries?
There's an opportunity every other year for an event called PrevCon, which is Prevention Convention, that brings all the coalition leaders together in Baltimore, usually every year. So there's that way. The internet is a lovely tool to connect us virtually, and so that has benefited us as well. The Upstate New York and New York region meets quarterly, and we meet with the worldwide organization as well, just to have an opportunity to talk about injuries and what new programs and grant opportunities are available for us to apply for, but also looking at the data and how often we talk. I would say pretty frequently, but more so than not, we are really focusing on our region that we're covering so that it's specific to that.
Well, let's talk about childhood injuries in upstate New York. What are the top preventable childhood injuries here?
The top preventable injuries in almost every country, state, or local community is falls. It's also the same in adults as well. So across the board, whether you're an infant until you get older, falling and injuring yourself or causing major injury is the number one reason that we end up in an emergency room or worse, unfortunately. Obviously, falls look different in children than they do in adults. And the prevention techniques that you use to provide outreach for children and families is so different than adults. Whereas adults, it's more learning matter of balance. They teach Tai Chi. They teach things that help them build core and balance and safety tools you can use within the home. Whereas with children, falls are so varied, and it's been the hardest target to nail as far as injury prevention outreach. While there's a lot of data about falls and how people fall, and we can look at the injuries and say, we know that child fell falling downstairs. The variable in how you do outreach around falls is so hard because there's so many different ways children fall and places children fall, and whether it's off the bed or at a playground. So that's number one. Number two, it generally toggles between motor vehicle and bike injuries, I would say, and pedestrian. So all the above, whether it's a child not restrained properly in a car or in a car and there was a car crash and that child was injured, or if it's a pedestrian situation where a child was injured by a car or being on a motorized or bike or something of the like and being injured. In pediatrics, the top three injuries also include abuse and neglect. But for the purposes of our conversation and talking about injury prevention, I focus on non-intentional injuries, and abuse and neglect is considered intentional, whereas your injuries like a fall or something like that are considered non-intentional. So I can't speak to that world as much, but we do focus on that as a hospital.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with Liz Sapio from the Upstate Golisano Children's Hospital. She is the coordinator for Safe Kids Upstate New York. In terms of prevention for the unintentional, you already mentioned how difficult it is to prevent falls because there's so many different ways they can happen. Are there some tips for parents in terms of just general prevention?
Absolutely. And while it might be hard for us to nail down the who, what, where, when, why, at all times when it comes to falls, we also know that most falls are happening in ways that if you are, for example, wearing at the playground proper shoe wear, something with grip, something with rubber on the bottom, the shoes are tied. You're not wearing clothing that is loose that can caught on materials on the playground, that the playground you're using specifically has a ground meant for falls, because a lot of playgrounds now have a different composite ground that helps to minimize the injury if there were a fall. Making sure an adult is around, that they're paying attention to a child. Probably one of the biggest factors across the board. And trust me, I'm sensitive to the fact that we use our phones for everyday life. We just do. We take pictures of our kids. Our life is in our phones, and it's wonderful in many ways, right? But a lot of times parents are at, or caregivers are at a playground because they need a break themselves. Kids need to get outside, they need to play, they need to have fun. And mom, dad, caregiver, grandparent, whoever it is, has had a long day and just also needs some relief. So unfortunately, it's not a blame. It's just a factor that you can be more cognizant of, that a lot of injuries for children, for example, in those settings happen because of lack of attentiveness. In the home, it's making sure that areas you don't want children to be in that could be a risk to them, for example, anything with stairs, anything they could get outside or anything of the like, that you have safety measures like gates or some kind of window or door alarm, something that beeps for little kids so that they don't get out. Or if they do, you know. For shopping carts, believe it or not, shopping carts are also a big area where we see injuries of children come, whether they are in the back of a shopping cart at the grocery store, playing around and helping mom get groceries, but they're not properly restrained, or it tips over because they're excited and stand up, or mom or dad or caregiver uses the baby infant seat and kind of puts it on top of the little part of the cart. I know it sounds so silly and simple, but those are the simple things. And those are what we try to bring out to the community so that people know this isn't hard stuff. And we're not also blaming you for maybe not doing it right all the time. It's just we really want to prevent your child from being injured and changing the course of your life. Really, it could.
It sounds like it. Well, what's important to know about motor vehicle or bike accidents?
Most importantly is having the proper helmet, and not just the proper helmet, but it properly fitting. People buy bike helmets because they look cool, and I get it. I mean, I'm a mother to now grown children, but when they saw things like that, it looked cool, so they wanted it, but it might not have been the right fit. So prior to going and shopping for a bike helmet for your child, I would recommend looking for them or having them go to a store and just making sure it's the right fit for your child. Also looking out in the community, if you can't afford a bike helmet and maybe you were given a bike by someone, there are plenty of bike events that we do, whether it's Save Kids or other community organizations, police departments, that have free bike helmet events. And so I would encourage parents to look for that so that you have that. One of the reasons we see a lot of falls on bikes is not because maybe mom and dad don't have a bike helmet, but maybe they go to a friend's house or they go to camp or wherever. So making sure if you take advantage of free events and have a couple extras so that you have them in places you might not normally have them. Motor vehicles is obviously a larger beast to tackle because motor vehicle crashes happen for so many reasons, but it also depends on the right space, the right fit, the right place for your child in the car. So what I mean by that is, for example, if your child is not old enough or big enough to sit in the front seat, they shouldn't be in the front seat. Recommendation is 12 and under are in the back seat. But I always tell people if your child can't sit all the way back in the seat or the front seat, their behind isn't touching the base of the car seat that they're sitting on. The shoulder and lap belt don't go over the shoulder and the lap, and their feet aren't touching flash to the ground, then they are at risk for internal soft tissue injuries, things like your belly or your liver, because the seatbelt could hurt it, and things like that. And I tell people never dismantle your airbag. It's meant to protect you and that child. As far as younger children, making sure they're in the proper car restraint system and properly installed every time is not easy. And I tell people utilize the community resources, including car seat check events, so that you can have a certified car seat technician check your car seat, make sure it's installed correctly, and give you tips on how to make sure your child's installed correctly in that seat.
What do you tell parents about safe sleep practices?
Safe sleep has always been a very sensitive issue because over the years, we have made recommendations differently to families and caregivers and parents once they've had a child. Back in the 80s, we were saying stomach is best so they don't choke, or 70s. So grandparents alike have heard this, and now they're watching these grandbabies and they're going, well, no, that's what I was told, and I'm a good parent and I did the right thing. And we're telling them no on their back. So what we try to make sure is people understand the anatomy of what choking is and where breathing is, and understanding that an infant naturally has a more open airway to breathe when they're on their back than they do actually on their belly. And it's easier for them to be suffocating themselves on their belly. Making sure that you don't use your car seat. I know I was guilty of it. Trust me, I do not judge any parent. I know that when my child, especially my first, fell asleep in the car and I knew I could get a few things done in the house after I got back in and I had a little respite to clean up or do a little laundry, go to the bathroom, whatever, that car seat, unfortunately, when it's not in the car, it's not at the same angle and it can cause asphyxiation. So you have to be careful with that as well. Making sure you're using a crib or cribette. And sleeping in the same room is wonderful. No one is ever recommending co-sleeping in a space, meaning a room. We just highly, highly discourage co-sleep in a bed. And that is just for the risk to you and the child, really. And making sure that there's nothing in the crib at night or anytime they're sleeping. Sleeping happens a lot with infants. So you want to make sure there's no pillows, blankets, toys, stuffed animals, anything like that. And just being comfortable having those conversations with family members that may be watching your child, or they might be sleeping there, so they feel good about what they're supposed to be doing, and give them some feedback. And of course, Safe Kids has materials that are really wonderful, easy reads, and gives explanation on safe sleep practice.
Let me ask you about poisonings. What chemicals or substances are you seeing?
Well, we here at Upstate are so fortunate because we have an amazing poison center. And because we have an amazing burn center with the Clark Burn Center, and we have an amazing poison center, I try to kind of let those experts handle those injuries while I do support them and provide outreach and education around them. I would defer for them to give more specific detail on numbers and details maybe from that standpoint. However, what I do know is happening and what we see at the Children's Hospital right now is two things. Button batteries are in everything now, whether it's your keys, your remotes, whatever. To children, they just look like a piece of silver candy and they're curious. So they put them in their mouths, and that can be gravely dangerous to a child. So making sure they're out of reach. And number two, now that THC and marijuana products are legal, people have them more recreationally now, even people maybe that didn't before, now that they are available. So whether it's in a gummy form, whether it's in an edible form or a drink form, we are seeing children getting into those at a more frequent rate than we had in the past and ingesting them. And I think the Poison Center would back me up. A lot of medications look like candy, and they have a great tool that they use to show that. So making sure all your medicines are out of reach of children. It's really just access to these things that can be preventing a grave injury.
What sorts of injuries do you see specifically in the summer months, and how are they prevented?
Around here, we do see an uptick in firework injuries because more people sell fireworks now and have access to them. So I would say fireworks. I would say drownings or near drownings are obviously a higher risk at this time of year. We don't have that risk maybe all year because of the climate we live in. And maybe that's why we don't see the same numbers as other regions and areas do, but we do see that. So to know a family has a pool, do they have proper gating around it? Are there people that are going to be the water watchers, people that are designated, no phone, no conversations, no alcohol, no drugs? And you can rotate that. If you have a fun family gathering at your camp or whatever the case may be, a pool, make sure that somebody is that person. And then if you are somewhere where there's open water, making sure there's lifeguards and you stick to where you should be in the water. I think those are the most important things for that. So the water, death, near death, and drownings, I would say fireworks. Obviously, your motor vehicle and your bike and pedestrian kind of uptick this time of year because more people are outside. So wearing proper biking helmets, abiding by the laws of the road, and making sure that where you're riding your bike is a safe place.
Sometimes during the summer months, we see headlines about tragedies where children were left in cars that became hot.
Correct.
Is there a way to prevent that from happening?
I think that there's a lot of people in the manufacturing world, and now that we have such great technology, that are on the cusp of developing some ways. And I think some cars do say, remind you to look in your back seat. I think the biggest risk is usually it's out of pattern or routine why these things happen. I don't think most do this intentionally, but it could be that normally dad takes the child in the morning on the way to work, but they're sick that day. So mom's doing it. And we're on autopilot when we go to work. It's routine, right? That's normal human behavior. If you're doing anything out of routine, I recommend somebody put something in the front console of their seat to remind them that that child is back there, especially because kids fall asleep. They might fall asleep in the car or whatever the case may be. So put a bottle or a toy or something there that triggers your memory. Go, oh, yes, I had my child today, because it isn't for lack of love and it's devastating to families. I know that people think around here it's not warm like it is other places, but our cars get very warm very quickly. And that has nothing to do with the region that we live in. That is just a fact. Even in Syracuse, it gets very warm very quickly. So even if you're running into a store or running a quick errand, please take the extra step to take your child out, because it can be devastating to them to be in there for a short amount of time.
You're listening to Upstate's HealthLink on Air with your host, Amber Smith. I'm talking with Liz Sapio from the Upstate Golisano Children's Hospital, and she's also the coordinator for Safe Kids Upstate New York. You also have some ongoing safety programs I'd like to have you tell us about. What's involved in baby safety?
Baby safety is really an all-encompassing outreach that we do within the hospital when it comes to infant safe sleep. Upstate Golisano Children's Hospital became a gold level safe sleep certified hospital back, oh gosh, it's been about 7-8 years now. I sat on the committee with some wonderful nursing staff. We put together the requirements to make sure that we became gold level certified. And what that means is that as a hospital institution, any child that comes into our hospital under the age of 1, we are acknowledging that they're at risk for safe sleep injuries, unsafe sleep injuries. So the nursing staff is talking about safe sleep prior to discharge. They are auditing the rooms to make sure there's no co-sleeping, even when the patient is in the hospital. And if we identify that a family does not have a crib or a cribette for that infant, or if mom or dad identify even the child that's not the ill child or injured child at our hospital does not have a safe sleep space, say they had another child, we will provide them one for free. And included in that, we do outreach around safe sleep in the different regions we cover, just to acknowledge that as an institution, we are putting our money where our mouth is. We're not just telling families this is what you should do. We are doing it, providing resources if they don't have them, and then educating the community on the larger whole. And that includes home safety as well, like baby gates and alarms. That's our internal process as an institution from Upstate Golisano Children's Hospital and at community campus for our newborns as well.
So it goes beyond just safe sleep. There's other things that new parents can do to prepare their home for a baby.
Well, we do provide any and all education, and I am fortunate because I can go to the bedside and sit with families, and nursing and our clinical staff have such an important job, and they really have to be paying attention to each patient's vitals and orders that a doctor might have put on. And there's so many complexities with being a clinician, right? But I'm fortunately to have the job that if they say, hey, Liz, I need you to come to bat for me, pinch hit. I don't have the time to spend with this family. They have a lot of questions, and I get to be in the room with the family as long as they need me, no matter how much, and also extend that to the community. So when they are discharged, they have my information and I can support them. I've done home visits to do a home baby proofing. Is this home safe? Am I doing the right things? We've done virtual visits. So anything like that that I can do to support a family's need or a parent that is struggling because I don't know what to do. I just moved into this new rental, right? A lot of families are living in rental properties. They don't have control over building this or putting this in. So how do I advocate for myself with a landlord? How do I make sure that working smoke detectors or that there's not lead paint? What programs are available? So supporting families in that way as well.
Now, you already talked a little about helmets and the importance of getting the right fit, but let's talk a little more about what's important to know for bicycling and skating also. Are the e-bikes that we see, the ones that are kind of motorized, are they
They
the
sure
same
are.
as regular bikes?
They are not. They go much faster and they are definitely something that should be wheeled on the roadway, or they shouldn't be if they're under 35. Children under the age of 16 should not be riding e-bikes. And the law says any child under the age of 14 on one and not wearing a bike helmet. It's double whammy. But unfortunately, these e-bikes are so new in the sense that people have them in their homes now. They're not just the ones we see, the green ones in Syracuse that are off to the sides. We're talking the ones that are purchased for their teenage child to go have fun in the neighborhood with. A little anecdotal story. The Safe Kids coordinator here had her 16-year-old son just admit to her that this horrific elbow and knee injury he's had scars on for the past few years was actually from being on a motorized scooter and falling, and him not wanting to tell me because he knew how upset I would be. And I feel bad that he didn't want to tell me as a mom, but at the same time, again, this is not about blaming parents. This is me giving him best information as a mom to keep him safe, telling him why he shouldn't be using these things, if he should have a helmet. But children are curious and they do things. And if they're with a friend and they have access, they're going to try and they're going to do these things. So again, injury prevention seems simple. It's not blameful. It's being honest and open with what can I do to prevent this? So having conversations with your child's friend's parent. Hey, you have an e-bike at your house. They have access to them. Do they have helmets? Do they have proper gear? Where will they be riding them? So having those conversations is important as well. Local police departments are putting out initiatives that are not punitive in nature. They're more getting the word out. So little citations that children are getting if police departments see them, that you need to bring this to your parent and have a conversation with them. We will follow up with you. They're taking initiative in that way. And I think that's important because we're giving people an opportunity to do the right thing, not punitively. And I think down the road, a lot of these laws and legislation will change, and that could come as we get further down and we know more about how to manage e-bike use.
So are the e-bikes and the motorized scooters, are those likely to cause more severe injuries because they're able to move faster?
Correct. Yes. And you have to understand when you're on those, a lot of people are riding them on the roadway. So you're now in traffic. A lot of times when I see people riding them, they generally aren't following the rules of the road. So just that in itself, speed, not following rules of the road, and safety precautions, I mean, that in itself is the reason. And people are wearing headphones, so they might be distracted listening to music. So all those things and variables added, that's going to increase the risk to the injury, but also maybe the severity of the injury may increase because obviously going at faster speed, but you don't know what they're hitting, whether it's a car or something else outside of a bike that you're motorizing. You can stop yourself or tip off to the side, or you're wearing a helmet. Definitely there's going to be data coming soon that'll show the modality or risk of severity is higher on an e-bike or a scooter.
Well, before we wrap up, I want to ask you about water safety and what's included in that.
I think most importantly is that free swim lessons are available at a lot of locations within our community. And I think parents need to take advantage of those if you can't afford to send your child to a private program or a Y that you don't have a membership to. But children learning younger how to swim and the safety in water is number one, a huge determining factor for lessening risk. Two, making sure they're wearing the proper water gear, an open water safety vest that fit them properly, wearing proper swimwear that is not going to hold a lot of water that could cause them to drown easier. If you have a pool, have a gate and alarm. If you know your child's going somewhere with a pool, having conversations about that. Who is watching my child while they're in the water? And then I would say, lastly, going back to what I mentioned before, having somebody that is paying attention to children in the water and anyone really. We're all at risk to drowning, just like we're all at risk to falling. We don't know in open water what's going on and what's happening under there, especially. So having somebody paying attention to water, regardless of whether you're a child or an adult, is one of the highest determining factors. And if you're somewhere where there's open water, where are the light guards? Where are they stationed and swimming near them so they have their eye on you?
At what age should swim lessons begin, or is there an age that it's too young?
I have seen children as young as 6 months old, mommy and swim me classes, teaching children how to get to their back. I think that any exposure to water and learning how to be aware of its risk as a parent is what is the most important thing for children. So if you can get into one with a little small child, they're going to be less scared when they take the real swimming lessons. Some children are scared to go in the water by the time they're 3 or 4 and there's this first swimming lesson. If they don't have a pool or if they're not by water all the time, that might be scary for them. But it's crucial because as children grow up, they're going to have more opportunities to be independent around water. And you want them to know how to swim confidently so that they can keep themselves safe.
Is boating safe to do with infants? Can you bring a baby on board a boat?
I think as long as you have a proper life jacket or child restraint, and if it's a mobile child, if it's a 8-month-old quick walker, it might be harder to keep them sitting on your lap. They're going to want to be out about because that's the nature of being a child that's young and learns to walk. So I think you have to know your child and know the person riding the boat is not under the influence and that the boat itself has all the safety measures on board and that you know the water and you're experienced. Having a child on the boat's a wonderful experience. Just making sure that they're in the proper vest and somebody is holding them and restraining them is most important.
Well, Mrs. Sapio, I appreciate you making time for this interview.
Thank you very much for having us on.
My guest has been Liz Sapio from Pediatric Administration at the Upstate Golisano Children's Hospital, and she's also the Safe Kids Upstate New York coordinator. The Informed Patient is a podcast covering health, science, and medicine brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/inform. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.